and postgraduate courses is now open for the following courses: Postgraduate Diploma in Monitoring and Evaluation, Postgraduate Diploma in Water Sanitation and Hygiene, Diploma in Community
Hello, everyone.
Yeah, I can hear you.
Welcome to today's session.
Yeah, welcome.
I can see we are still joining.
Yes, good morning, everyone.
Good morning, everyone. Good morning, good afternoon, good evening, from where you're joining from.
Good morning.
Welcome to today's webinar.
Yeah, welcome.
Webinars on fundraising. In fact, we had one yesterday. We had webinars on project management. We had webinars on water and sanitation, monitoring and evaluation. My name is John Karegwa. I'm a development consultant and a fundraiser. Please let us know where you're logging in from. Just indicate in the chat so we know how we are represented. Please, let's do that very quickly. Nigeria, thank you very much, Nigeria. South Africa, Zimbabwe, Kazakhstan, Yemen, Sudan, Mozambique, Nairobi, Turkey, Ghana, Malawi, Kenya, Bangladesh, Zambia, Jordan, Rwanda. Thank you, Rwanda, Turkey, South Africa, Kenya, Lebanon, Kisumu, Kenya. Thank you very much. Thank you very much, everybody. Somalia, thank you very much. I think the world is represented here. Thank you, thank you, thank you. Lagos, South Africa, again, South Africa, thank you. Nakuru, Kenya, Somali, Rwanda. Thank you very much. Thank you very much. Thank you very much. Let me go straight to the agenda of the day. Kisumu, Niger, thank you. Sudan. Today we have two guests. We have Sandra, who is from Cambodia, is going to do a series, is going to do a presentation on monitoring and evaluation. Monitoring and evaluation, as you know, is very, very important for development work. It's also one of the most sought, profession in the development work. So when you have skills in monitoring and evaluation, you ensure that development work is done right. And in fact, it's one of the biggest, we have had the biggest number of students taking that course, just telling you how big the demand for the sector is. We'll also have our own Stephen Mushami, who is a WASH consultant, who's coming next. So I would like to invite Sandra from Cambodia. He's an M&E specialist to take us through a session for 1 hour. Then I will take questions and answers. And after that, we will invite Stephen Mushami to take us through the next webinar on water and sanitation. Thank you very much, everybody, for coming in. And we thank you for your continued support. And let's make a better world by offering services and changing our communities. Thank you. Sandra, you can take the podium and introduce yourself and take us through the session. Thank you and welcome.
Okay, thank you, John, for inviting me as well as introducing me to everyone here. I know that everyone here is expertise in monitoring and evaluation in the professional project in any country in Africa or other areas. I would like to introduce myself. My name is Sandra. Currently, I'm monitoring and evaluation specialist for USAID Cambodia in the Fit the Future program, and which work in the areas of horticulture solution. And now, as you have already known that clearly about monitoring and evaluation, because it is very important to monitor our project as well as programming. And all of you know that monitoring and evaluation Could you share my slide?
Yes, we
Could
can
you see my slide?
Yes, yes.
Yes, we can see.
Yeah, yes. This is a brief myself.
Yes, we can see.
Yeah. Okay. In the presentation outlines, I would like to briefly in the 3 parts, which the first part regarding to the basic of monitoring and evaluation and its purpose, and how monitoring and evaluation is differentiated, and also describe about the component of monitoring and evaluation plan as well. And the second part, I will provide additional debrief about the framework and logical model. And the third part, I will debrief about the indicator and data source for the program as well. And in this section also, we would like to clarify about the criteria of selection the indicator and how the indicator link to the framework, and I did identify the data source how to use for for our project monitoring as well. Do you hear me clearly?
No, we can't hear you clearly, please. Can you kindly fix your audio?
We can hear you clearly.
Oh, can you hear me clear?
We can hear you clearly.
Okay, thank you.
Yeah.
Yeah.
Come closer to the microphone, please.
Yep, thank you. Okay, could you tell me again, please, what is monitoring and what is the purpose of monitoring as your perspective? Could you share me, please? Anyone can share about the experience or perception or understanding on what is monitoring and what is the purpose of monitoring? Who can? Yeah. That's great, please. Please, you can say me. Okay. Say your perception about what is monitoring mean to you. Okay.
You can read the feedback in the chat.
Yep.
You can read the feedbacks in the chat.
Okay. Okay, thank you. Actually, yeah, that's great. Monitoring is observe, of tracking the progress of again the project activity and continuous process of tracking of project activity. Okay, absolutely right. Because monitoring is the process regularly that we conduct to track the progress about the project implementation. The monitoring is conducted gradually or always in the project life cycle. And the purpose is to track and confirm for manager in decision making how to plan to do the next step to accomplish our agreed objective. That is the monitoring definition and its purpose. How's about the evaluation, and how about the evaluation purpose? Could everyone say us about your opinion or your expectation as well as your personal idea regarding evaluation? Yeah, please share your opinion in chat. Okay. Yep. Okay. Other one? Okay, great. Thank you for your providing idea. Evaluation is the systematic process which we conduct to measure the achievement against our agreed objectively. The element that we would to conduct the evaluation to assess the impact, effectiveness, efficiency, foreign, and outcome as well. And generally, evaluation is always conducted at sometime at midterm or an evaluation, but baseline also attitude as the evaluation, because baselines will provide the information and the benchmark of our indicator at the starting project. So baseline also attitude as the evaluation as well. Yep. Okay, right now I go to the next. Oh, why is my slide could not move? Okay, this is just a brief what we have already discussed about monitoring and evaluation and its purpose. And monitoring is like you have already mentioned that involves of data collection and routine data to measure the progress. And monitoring can happen always alongside the project life cycle in terms of to access the data to confirm the indicator as well. And it purpose to track the change and also provides information to the other stakeholder and manager in terms of to decision making as well. And the third one is provide the efficiency of resource use as well. Okay, what is evaluation? And evaluation is a system of collect data and analyze of information, and those data to compare and to track the impact of the program implementation, as well as consistency with the project direction or effectiveness, or improve the program at the future program as well. Why is monitoring and evaluation important? Because monitoring and evaluation will inform to our manager in terms of decision making, how to operate the program in the local area as well as in our project target area as well. And secondly, the monitoring and evaluation provides the manager in decision making to use the resource effectively. And monitoring and evaluation also provide a report and other requirement that persuade the donor to invest more budget in terms of to accelerate or implement the activity at the future in our target area as well. That is the monitoring and evaluation that we have important. And the difference between monitoring and evaluation, as you have already mentioned, that monitoring is ongoing. It doesn't mean that you conduct alongside the project implementation, but evaluation is not continuously. It is happen at the starting period or midterm or end of the project. Then they conduct evaluation, and evaluation need to be provided, or as well as prepares any document to support and to do the evaluation metric that all evaluator need to do. And monitoring is a continuous process, but evaluation just use a data collection at the start and at the end of the program, just specifically time frame. And monitoring data collect at multiple points, mean that gradually and ongoing process of data collection throughout the project cycle. But the evaluation just use the control and comparison group, mean that we compare between baseline surveys and online surveys, online evaluation to compare the progress against the indicator that we have already agreed in the logical framework, or as well as agree in the proposal with the donor. And monitoring is tracking change over time, from time to time, but evaluation need to prepare well for the study as well. I mean that they design the evaluation framework and sampling method or other questionnaire to identify the key change regarding to each indicator in the project as well. That is the difference between the monitoring and evaluation. And another one, as you have seen the cycle of project cycle management, so I would like to ask you that what step that monitoring and evaluation take place in the program cycle? Have you seen my slide? Yep. Step one, we assess or strategic planning, design, monitoring, and evaluation. So monitoring and evaluation should be designed, should be take place in which step? If somebody know, you can ask, you can answer. Okay, let me go. Okay, monitoring and evaluation. It would be necessary to design and take place in design process, in the design stage, because in the design stage, monitoring and evaluation mostly design both project and logical framework, and some other use result framework. That is monitoring and evaluation should be designed and take place in the design phase in the program life cycle. Yeah. Okay, do you have any clarification? Okay, Patrick, could you ask? Okay. Okay. Yeah. Okay. Thank you, Patrick. Okay. Yeah.
So that's how planning. But for now, I think we have this opportunity to make sure that we are able to just add
Okay. Could you ask me again, please? I could not hear you clearly right now. Could you ask me again, please? Okay. Actually, this slide is not clearly for you to read because it is blur. Yeah. Now, so I go through another slide. What element that have in the monitoring and evaluation component? Yep. In the monitoring and evaluation component, we should have some other have another section or element that contribute in the more detail about the monitoring and evaluation component. The first component is introduction, that you would provide the more detail about the breakdown of project, about the background of project and other risk assumption, as well as other framework that you would like to provide more or to show the issue. Why is the more detail about your background and the issue and root cause as well. And the second part, the program description and framework, also provide you to provide a more input about how to solve those problems. And the section 3 also provide the indicator definition as well, more detail about the indicator in each component that you would like to show to implement and accomplish the project agreed with the donor. And we also contribute with the data collection plan in those areas that you have already stated outcome and output level indicator, how to collect it, and which tool that we would like to develop to collect those data. Will detail more about in the data collection plan. And the plan that you would like to monitoring about it is talk about the time frame that you would like to monitor in each indicator. Some indicator you already said that how frequency to monitor this indicator, how to track those data, how to use your questionnaire to track data. So this is regarding the plan for monitoring that you would like to illustrate to the reader, especially the field staff, to understand about the requirement of data that you would like to collect. And for evaluation, also provide the brief what time that the project would like to conduct the evaluation, how many steps that this project need to conduct the evaluation. Sometimes you already mentioned that this project is required by donor to conduct two evaluation stage, sometimes midterm evaluation or a final evaluation. So this will include in this section as well. And another section, when you get the information, how you disseminate those data and how to use this information and sharing to whom. So it also provides more clearly about who is the stakeholder that would need your data: donor, management team, or other stakeholder. And the second, the last one is a mechanism for updating the plan. So I think that our project also have challenging regarding to change any plan regarding the monitoring and evaluation. So we can adjust it and update it and inform it to manager as well as to donor as well, to know about your situation and the project implementation stage. It is necessary to illustrate the reason why you need to correct or you need to update your plan. Yeah. If you have any clarification, please feel free. Yep. Okay. Could you hear me right now? Okay. Thank you. Okay, I will move to another slide. Okay, right now I would like to have another clarification regarding to the framework. Some of you know that there are many framework that would need to clarify. Somehow they call it research framework or conceptual framework, result framework, logical framework. It is very comprehensive, and it is would need to be clarified. Okay, conceptual framework generally it is provides the underlying and illustrating the relationship between the outcome and other program intervention. For especially, I would like to provide example: food security framework. Food security framework. Food security framework consists of 4 elements like food availability, food accessibility, food utilization, and food stability. There are 4 elements that they call it the relationship with food security. But it is just a clue. It not provide clear direction that which activity that you would like to do to complete complement in each component. It just provide you a clue and provide a relationship between those elements to the food security. It not provide you clear about the what activity, what activity that you would like to do to accomplish the food security. It is it just provide a short and deep brief and clue for you. Okay, your another result framework. Somehow they call it a strategic framework. It is a provide causal or direct causal relationship between the result and key activity. For example, if you conducted any training regarding to hygiene promotion, so what the result is? So the result is might be children know some critical or something called in terms of hygiene promotion in community as well. But the result framework, mostly the result that they put into the framework is just put up, but the activity at the bottom. So it is also illustrated the correlation between output and activity and the result. So it also illustrate the result as well, and it is also provides.
Sorry, Mr. San.
Yeah,
can you hear me?
Yeah,
would you mind
I
just
can hear you.
Would you mind just adjusting your earphones a bit? Your audio is a bit muddled. I'm seeing a lot of comments about that in the section. So would you mind just maybe adjusting your earphones or your microphone so that they can hear you clearly?
Oh, you cannot hear me clearly?
It's very muddled. I think it's the earphones. There's an echo when you speak.
Okay. Right now, you can hear me clearly?
It's a bit clearer now, yes.
Yeah. Oh, thank you that you provide the constructive feedback. Okay.
Thank you very much.
Yeah. Okay, this is the last logical framework. Logical framework, everyone can know they call it M&E framework. Yeah. It is a matrix that provide a streamline that we can correlate between activity, result, objective, and project activity. So they did correlate as well. And most of NGO, they design the logical framework, but it is generic. We could not somehow we cannot adjust it to improve our implementation. But it provides more clearly about the activity and result and objective, and as well as the outcome level and overall objective. it is provide clearly information that you can decide to do. Okay, another one is how's the framework used for monitoring and evaluation. Actually, conceptual framework, it is provides a brief description only, and it is provides our manager or our staff understand the factor that each component influence to each other, correlate with the other component. But conceptual framework could not just can help to could not help us to explain the result. And but result framework, it can help us to identify the program management and show us the relationship between the program objectively and activity. And it is also provides the monitoring and evaluation in terms of at the objective level. And by the way, logical framework, it provides the relationship between both input to the objective, and it is provide all information that all component of the project implementation, from output, activity, outcome, impact as well. It is also provide a clear instruction to the reader, especially to the project and field staff as well. Logical framework, it is more comprehensive list information that allow us to know and to understand all aspects of our project implementation. Yep, it is the benefit that framework used for monitoring and evaluation. Okay. Right now, do you have any clarification? Please drop your in the top chat, and I will answer all your question at the end of this session with the okay. In the monitoring framework, we would need also the indicator. What is indicator? Other NGO or other some of you that have know that indicator in the program implementation, they define indicator. The indicator is a variable that measure the aspect of the program. Is the clue or is the sign, or sometimes they call it that is the benchmark value that we would need to find at the baseline survey of each indicator. And why indicator is important? Actually, indicator will provide us the guide to find the starting value, and also provide the guidance us to how to complete or how to improve the base value to another level of achievement in each indicator as well. And specifically, indicator also have some part in the outcome level or output level, or an immediate result level as well. So they categorize the indicator by the strategy of program implementation correlation. So indicator also measure about the outcome change that we would like to accomplish at the end of project. That is also provides the clear direction for our program to implementation or to attitude it is a success or not. That is an indicator. And how indicator link it into the framework? If you have known that our framework have other hierarchies or component that starting from input, process, output, outcome, or impact. So in each component, they have each indicator. And for example, input level that you have stated that you have three staff to conduct the training. It is just the input, but if the staff conduct the training, it becomes the process that you conduct the training through workshop in each district or at provincial level. Or somehow I would like to provide example that you conduct a financial partnership training or financial partnership training to rural community organization, and the output, the trainee, they already catch up your lesson and they can apply. And the outcome, the practice skill that they have from the training, and they apply and they provide they apply the financial partnering to help rural farmer or rural poor people in the community. And the impact, it is also decrease the child drop, especially some activity that they can get the benefit from the training as well. So this is the linkage between indicator and framework. And however, the indicator could not attribute us more specifically. Some indicator could not provide us the full information and definition to measure it. It is the guideline for us to select the indicator. At this slide will show you how to select the indicator. Yeah, and this slide also provide the information for you to in terms of select the right indicator for your project as well. The first one, the indicator require the realistic, meaning that those definition is clearly. And second, in each component should they have only one or two indicator is much. It is enough for in each component or each output indicator should be have only two indicator. And the third one, for the outcome level should have only one indicator enough. If those outcome level there are three more four indicator, it would no need to do that, because it is provides we have many indicator that would need to measure, and we also need to develop the monitoring or data collection tool more for our staff as well. And the fourth one, we should select just only 10 or to 15 indicator for a whole program. So it is enough for our for the program that we should have only 10 to 15 indicator. And the last one, we use the mixed data, the collection source whenever possible. But some data could not, we could not collect in the time frame of the project implementation. So the data that we some data is routine and some data is non-routine that we would need to clarify, to classify those as well. Yep, right now it is a criteria that you would like to provide example. I have placed the indicator. I increased contraceptive prevalence by 15 in women from 30 to 49 years of age. It is smart or not smart? Yes. This section will provide you the criteria that you could consider about indicator selection. We use SMART. SMART means that specific. Yes, specific. The intent outcome that you require for the program is specified. And measurable, contraceptive prevalence is measurable, could measurable, and bad, achievable that we could not know clearly about the program goal because we could not know clearly about the characteristic of our goal with correlate with our program goal as well or not. And realistic, we could not identify clearly about the resources that available for the program. And the time frame we also could not we could not understand what time would need to be measure this indicator. So this indicator should be more clearly specific, but use the SMART model to identify or to select those indicators for your program. It is also important that we need to specifically regarding to indicator selection for your program. Another one regarding to characteristic of indicator. Yep, exactly. The indicator that we select should produce the same result when you conduct the monitoring and evaluation. So we use the same result, and we mean that we use the same condition between in each indicator, and do not use different condition in each indicator. So indicator we could produce the same result with the same condition, and in each indicator should measure just only use the only one condition for instead of you can use multiple conditions, so it is not good for indicator. And indicator provide us the change from the condition over time, that from the project implementation to the another phase to also provide the change. And it is also represent the measurement force that we provides more monitoring process that would need have spend much time, spend much budget to do it. Yeah. Okay. Another one is challenging regarding to the selecting indicator. Indicator that the program activity that cannot affect. It is regarding to our indicator that could not affect to the program objectively. So somehow those indicators could not relate to the program intervention. It is the challenging that we need to clarify with the program management that consider to select those indicators and put into the program implementation. So in each indicators must correlate and support to the program objectively and program purpose as well. And another one is selecting the indicator that not accurate represent. This means that some indicator less correlate or did not match with the requirement of our outcome or our objectively. So it is also the challenge that we need to clarify as well to identify the appropriate indicator for our project implementation, and also provide a clearly instruction data collection to verify or to measure those indicators clearly with project team as well. It is necessary that every staff need to know about that. Okay, in terms of to collect those data to comply with the indicator requirement, so our staff as well as the project team need to know about the data source that you would like to capture from those to include in the indicator calculation. Those data comprise routine data source and non-routine data sources. Non-routine data sources provides you the information, but it is separately provided by periodically basis, like annually or provide less frequency than routine data. Routine data that you would like to capture to fill in the indicator, like monitoring or daily monitoring or daily report, that you can collect it to illustrate, include in the indicator. Those data sources provides you the information. So we need to clarify that those data, which data that you would like to capture to complete in the indicator requirement as well. It is necessary for our staff and program management team to design and provide more corrective action to our field staff as well to implement our project activity at the rural level. Okay, that is my slides already finished. So if you have any question, could bring it to discuss. Yeah, thank you.
Hello everyone. Thank you so much for joining us today. My name is Rachel Mwenda. I'm the training manager at Capacity Africa. And thank you so much, Sandra, for your great presentation. I hope you have all learned something from the presentation, and we are going to take up a couple of questions.
Yep.
Anyone with a question? We have a few people in the chat who are asking questions. Suhaili Mamadairamo, I hope I said that correctly. Suhaili? If Suhaili is not ready, we can go to Franca Adina.
Yeah, please.
Please, it's your chance. You can now ask a question.
Hello. Hello.
Yeah, I can hear you, please.
Is anyone with us? Hello?
Yep, I can hear. I can hear.
I'm asking, is anyone asking a question? And you'd like to ask Ms. Sandra? This is your chance.
Okay. Hello, I'm Wisdom. I think
hello.
basically the question that keep coming up is the theory of change question and how it's related to all the other types our presenter enumerated. So if you can explain that and do the connection for us, we will appreciate it. My second question is on data collection. You know, usually if you want to do some monitoring evaluation like the topic he suggested, contraception, we usually use baseline data, but then he didn't make any reference to baseline data and how you have to acquire them and process them and get them ready for your subsequent monitoring and evaluation. If you can touch on that, I'll be grateful. Thank you.
Okay, thank you for your quite clear question. That actually is the baseline data, so we can generate at the start of the project, and data collection or questionnaire design also discussed with our team as well. So it is provides the benchmark of the indicator that we already achieve at the baseline state. It is measure the benchmark at the beginning of the project implementation. However, the monitoring and evaluation is also provides more additional value that our project performance implementation. It is our project implementation performance that add value to the benchmark, and also it is also provides more useful for the program evaluation as well, because in the evaluation report they also provide this information that our project have make an effort to accomplish, and the indicator that we would like to measure also change as well. It is necessary and it is complementary to each other. So that is a response to your question. Okay, that is a response to your question or not? Would you like to clarify?
I think it's okay. We can move to the next question. Abdul Basit.
Yep. Please.
Yeah. Abdul Basit, Al-Shamiri, you can ask your question. I can see your hand is up.
The question before about the theory of change and the logical framework, could you elaborate on it more?
What, please? Monitoring and evaluation framework?
Yes.
Which step that you would like to clarify?
The theory of change and the logical framework, are they similar or different?
Logical framework and serial chain, it is quite
yes.
different, because serial chain, it is need to take more time to on step to provide the guidance to explore the activity. Mostly serial change, it is happen to start to develop the program, the new program as well, but it is also provide the current information that would like to show as well. But I think that it is also provide the same state of logical framework, but the process it is different from logical framework. That's right.
Okay, I thank you very much for that answer. Shadrach Gwari, you can ask your question.
Yep.
Yeah, okay. I'm from Zimbabwe, Manicaland province to be specific. My question is when hiring monitoring and evaluation specialists or officers, say we have an organization that is having different interventions, like an example, an agricultural intervention, health intervention, income and savings intervention, wash, that is water and sanitation intervention. My question is, will it be really necessary to hire different monitoring and evaluation officers as per the area of specialization, agriculture, food security, livelihoods, or income? Or we are saying that one very person, as long as he is a specialist in monitoring and evaluation, there is no need for specializing in the area of intervention, because we have differences, especially in Zimbabwe, when organizations are hiring. They'll say, yes, you are a specialist in monitoring and evaluation, but your background is agriculture or your background is health. We cannot, you are not given the opportunity to be hired. Thank you.
Okay, thank you. Just I would like to clarify that it is based on the program requirement, where they choose, they would like to recruit the monitoring evaluation officer in each component or not. But as my observation, those programs have different background and expertise. So I think that the program should consider to hire a monitoring and evaluation officer in each component. And based on the rule of thumb in each program, they reserve the budget from 5 to 10% for monitoring and evaluation, both staffing, training, or etc., or learning as well in monitoring and evaluation as well. So I think that most of manager and program team need to consider whether they should hire monitoring and evaluation officer in each component or not. Because I think that if one person and they hold monitoring and evaluation in different areas, so they would not be able to more understanding about those criteria in each sector, like agriculture or was economic livelihood. There are different expertise and different definition of each component. So this is the challenge that some NGO they could not afford the budget to hire monitoring and evaluation officer for each program or each sector. But as my suggestion, those NGOs should hire different monitoring evaluation officer to to do the monitoring evaluation work. Yeah, that is my opinion.
Okay, Okonjo Jr. has a question as well. Okonjo, you can ask your question.
Yes, hello.
Hello.
Okay, my name is Okumu Frederick. I'm from Kenya.
Yeah.
And my question is on how to come up with the TOR, that is a table of reference. Can you maybe just highlight on how to come up with the TOR?
Okay, TOR regarding to monitoring and evaluation, or just regarding to the evaluation?
Regarding to monitoring and evaluation.
Oh, okay. Regarding to TR, yes, TR is the same that they call a monitoring and evaluation framework. It is somehow they use those terms. Yeah, the same. TRR or monitoring and evaluation framework, the same. Yep. Do you have any question?
I think Okonjo, we can now have Tinashi Munyunzani. You can now ask your question. Tinashi.
Thank you so much. Yes, I'm Tinashi. So
Sorry, Tinashi, we can't get you.
We cannot hear you now.
Current structural pen. Oh, hello. Can you hear me now?
Yeah. Now we can hear you.
Okay. Yeah. Thank you so much. I was
Hello,
just hoping
Tinashi?
that maybe you're
Hello?
going to, if you can share. Hi, can you hear me?
Yes, we can hear you now.
Okay. Thank you for the presentations. Thank you so much. However, can you please share the slides? I don't know if it's possible after the training to share them with us so that we digest, because some of the sections, the network was bad. I couldn't really get you of change. Like, really, where are we coming from?
Okay.
Where are we going? What are we trying to achieve? Monitoring it.
Okay, we will share the slides on YouTube on the Strategia Netherlands. And then you can also provide your email where we will, on the chat section, where we will send you the presentation.
Yep. I think that Strategia Netherlands will provide you. Yep.
Okay. Edwinio Bowman also has a question. You can ask your question.
Yes, so this is Edwinio Bowman here in Liberia, West Africa. So I want to say thank you for a very short and a very wonderful and powerful section. I think it's worthwhile. I mean, it's very practical. But now we all know that monitoring evaluation is evolving. There's more need now for learning and collaboration. Now we realize the impact for projects is basically on sustainability. I've worked with a lot of projects where after the donors or NGOs leave the country, you don't see the project being sustained. And based on that, most NGOs now are looking at changing their models of working to ensure that we have more projects that are being sustained. Do you have any future plans? Yes, this is powerful, this is nice. Do you have future plans to provide some other additional sessions on collaborative and learning for MAE also, instead of just basic MAE? And if so, I would be interested to be one of those to join your next webinar.
Okay. Thank you for your interesting in this seminar. But I think that Strategia Netherlands will provide more information about this.
Thank you so much for that interactive session. I think now we can move to the next section. And if anyone has any question to ask, Victorine and Beatrice have shared email addresses on the chat section where you can be able to find more information on the presentation. Now I'll introduce Victorine Onchari, who's going to have a presentation about Capacity Africa and Strategia Netherlands. Victorine, welcome.
Thank
Yep,
you.
welcome, welcome.
Thank you. Am I clear? Can everyone hear me?
Yeah, we can clearly hear you.
Okay. I'm just going to share my screen. Perfect. Right. Hi, everyone. Thank you so much for joining us. Thank you for such a lovely session, Mr. San. My name is Victorine. I am the training manager for Strategia Netherlands. And I want to just briefly tell you a little bit about what we offer as an institution and how you can benefit from our services. Now, Strategia Netherlands is an international organization. We are based in the Netherlands and we focus mostly on offering training and organization in the humanitarian field. We've had over 10 years of experience in this sector and have trained a lot of students with over 15 countries worldwide. We've worked with a lot of key organizations within the humanitarian NGO sector. Just to mention a few, we have the World Health Organization, USAID, UN Women, and KenGen. We've also worked with the Ministry of Health in Kenya. I've heard a lot of questions so far about how we can, if we offer any other additional training beyond the content of today's webinar. So I want to tell you a bit about that. We have a number of different courses on offer. One of our most popular one is monitoring and evaluation, which is, you could say this is a snippet of what is involved in this monitoring and evaluation course. We have this in a diploma level, certificate level, and postgraduate level. In addition to that, we also have WASH, sanitation and hygiene. WASH, which is who our next speaker will be speaking about. Grants management, we have project management, public health, food security, there's conflict management, disaster management, and a bit of fundraising and proposal writing. There are a number of different courses, over 200, and if you'd like to find out more about this, you can very easily just have a look at our website and you'll be able to see the full list of courses. Now, in terms of the kind of classifications or groups of the courses we offer, we have certificate courses which go for 3 months for 400 euros. We have diploma courses that go for 6 months for 800 euros. And then we have the postgraduate diplomas for 1 year at 1,200 euros. Now, one of the key things that stands out about the courses we offer to one, the e-learning mode of teaching, as well as a self-paced aspect. As I'm sure most of you are working, you don't necessarily have the time to have an 8 to 5 schedule. So our courses are designed in a way that you're able to learn at your own pace, follow up on assignments when you can, schedule meetings with your lecturers in Zoom sessions. We also have quite a number of webinars such as this, where we bring in experts from the industry who are able to kind of impart knowledge on these various fields of the topics and subjects we offer. Now, for those who might be interested in this, we usually have 2 intakes in a month to allow for almost everyone that would want to join the 1st of every month and the 15th of every month. If you want to register, I'm going to share a link in the chat section, but you could also just easily send an email to info@strategianetherlands.eu. Now, for everyone that is in this session today, we are having an offer running for December and January, where you could get 20% off on all our courses, any of them, where you decide to do monitoring and evaluation. If you're interested in grants management, whatever it is a 20% off on all our courses for the December and January intake. All you'd have to do is just send an email to this email address and just quote webinar promo, and we'll be able to kind of assist in that. I had one of the participants asking if we have any other webinars or if we offer any other trainings beyond this. You can follow our social media channels, as well as our YouTube channels, where most of the sessions of the courses or the webinars we run, you can find them on there, and then we can keep you updated on when the next sessions are, if they're free, the speakers that will be kind of taking part during that session. We've also heard from Rachel. She is a training manager for Capacity Africa, which is our African kind of based institution. And you can also find more information. We put this on the chat on the courses that we can offer. The 20% also runs with Strategia Netherlands as well as Capacity Africa. So this is, I don't know if we have any questions that I can take briefly, or if this information is clear.
Victorine, I would like to clarify one question that I would ask.
Yeah.
Whether what is the requirement of applicant that can access your e-learning?
E-learning, okay.
Yeah, but
so as I mentioned,
yep.
Yeah, so as mentioned, we have 3 main courses. All of them have different requirements. For example, the certificate would have a slightly different qualification as opposed to postgraduate diploma. We are mostly, we focus more on academic, not academic, but occupational training as opposed to academics. So for example, for the postgraduate diploma, we would require a bachelor degree. But if you've had extensive experience in a specific field, that would kind of make you eligible for the postgraduate diploma, this is also possible. So we try to evaluate this on a kind of case-by-case situation to ensure that all of the participants that come to us are able to kind of gain the same knowledge. I again mentioned that we try to focus more on occupational training as opposed to academic. So for example, if you were to go to university right now and you didn't have the proper qualifications, they could say, no, you don't qualify for this. But we understand the need of the training that we're offering, specifically in the NGO sector, to ensure that anyone that want additional training, capacity building in different fields of that area would still get the opportunity to do this. So if you're interested, you could always just send us an email and we can look at this on a case-by-case situation, and we'll see how we can kind of guide the best certificate and the best could apply to your situation.
Yeah. Thank you, Victorine. It is clear right now.
Thank you.
Thank you, Victorine, for that presentation.
Thank you, Rachel.
I can see, okay. I can see Wisdom has a question. Your hand is up. Let's see whether he has a question for us.
Hi, Wisdom.
Okay, hi. My concern is about the fees. So you made you showed us 20% discount, and I want to know, with the postgraduate diploma, is there any kind of scholarship, like 100% scholarship? Because I'm really interested in the many postgraduate.
Yeah, thank you, Wisdom, for that question. We currently don't have any scholarships on offer. We do, however, on again, case-by-case situation, we can offer a payment plan that would ideally ensure that you're able to complete the course and still kind of financially cater for that. So if you're interested, again, please just send an email to this email address, and then we can just chat and see what the best way forward would be for you. Is that clear?
Yes, that was clear. I can see from the chat section that Patrick has a question. So Victorine, if you could kindly tackle that.
Yeah, let me just have a look.
Yeah.
Okay. This is from Patrick?
Yes,
we need to know the physical location. Yeah. So as I mentioned, we're based in Rotterdam in the Netherlands, but our courses are mostly offered through online mode. So I can share the exact location if you'd like, but in terms of the delivery of the courses, this is mostly done online. I also see there's a question of whether we only offer courses in English. We actually have a French. We offer the courses in English and French. So again, if you'd like more information on this, just send an email and we'll be able to guide you on and give you the proper information on the French courses as well. Okay.
Thank you, Victorine. I think
thank you so much.
Has all been covered.
Okay. Anyone that has any other questions, you can just very briefly just send an email and we'll be able to assist you with the process of enrolling with us. Okay. Thank you, Rachel.
Thank you to Victorine. I would like now to introduce our next panelist, who is Stephen Mushami. He'll be taking us through water and sanitation. Stephen, are you there? Hello, Stephen. As we wait for Stephen, we could take another question. Anyone has Anything to ask?
Hello, can you hear me?
Oh yeah, Stephen is here. Hi, Stephen.
Hi, I can hear you very well.
Yeah, thank you for joining us today.
Okay. So that's fine. I can continue.
Yes, you can.
Okay. So thank you, Rachel, for being able to invite me and just to be able to go through what we have for today. Sorry, I missed the previous session by Rasan, but of course I'm going to be able to listen to the recording and just make sure that I can familiarize with what was able to happen. I just want to be able to go through a number of things that basically introduces you to this particular session, and it is important for us to be able to look at that. And just a minute, give me some few minutes. I just check on some.
Stephen, I could not hear you.
Sorry, can you hear me now?
Yes, Stephen, we can hear you.
Okay. So sorry for that. I think I had some problems being able to share my screen, but I hope you can be able to see my screen now. I hope my screen is viewable from your end. Are you able to see my screen now?
Yes, we can. It's visible.
Okay. Okay. Yeah, so basically we want to look at a number of things for just about an hour. We will be able to look at some introduction to water sanitation and hygiene, which is also a critical emphasis that we would want to be able to emphasize to our audience today. And also we'll also be emphasizing something to do with the global distribution of fresh water, which is also something that we may want to be able to emphasize so that we can actually be able to see why it is more important to make sure that we do our wash management interventions critically. And again, also look at just some overview of sphere standards in WASH, because these, the sphere standards is one of the most critical standards that we have in water sanitation and hygiene sector. And it is always good to be able to see what some of those standards basically specify. Then of course in WASH, we talk about the F diagram, and we always want to make sure that we have a very good understanding or significance of the F diagram. Is something that we always want to be able to understand. Then of course the other thing is to make sure that we can always be able to have an overview of community-led total sanitation, which is one of the critical WASH approaches that we have. Of course, we have many others, but this is one of the most important because it normally involves the participation of the community towards addressing the sanitation challenges for a particular community. So we'll be looking at that and basically have some participants feedback session and ensure that we can be able to understand something about that. So, of course, let me start with the first thing, which is simply just to be able to have an introduction, basically have some introduction into sanitation and hygiene. And one of the things that I would just want to begin by saying is the fact that safe drinking water and sanitation and hygiene are very, very fundamental to improving the standards of living for people. And I think it's very, very good to be able to look at that. And improved standards of wash has many benefits as listed there. That is a very good list, basically just to show you the standards that are there. So, so as you look through that, maybe something can come up into your mind. So one of the things that you can actually be able to see in regards to improved standards of wash, there are quite a number of benefits that we can actually be able to look at. One of it is basically be able to look at the whole importance of better physical health. Then secondly, also look at the protection of the environment, ensure that we have better educational outcomes, and also ensure that we have convenience and time savings. And let me just be able to emphasize the issue of time saving and why we are able to emphasize emphasize the whole issue of time savings is because you realize in areas where we have challenges with water supply, you realize that majority of the time for this community is actually spent looking for water. And this is one of the things that we actually want to be able to address. That is why when you're able to address the issue of water supply and sanitation, you realize that you are able to address the issue of time saving so that people can have important, significant time to focus on economic activities instead of just focusing on being able to get water for use at the household level. So it's always good to make sure that that is something that can always be looked at. So it's important to make sure that we can focus on having some improved standards of wash, and most poor and vulnerable populations will normally have lower access to improved wash services. And of course, they have some poorer associated behaviors, and that really becomes a very, very critical challenge to be able to consider. Now, when you look at the whole issue of improved wash as being central to reducing poverty and also being able to promote equality and also support socio-economic development is very, very true, because you can imagine being able to deal with some of these challenges that actually would end up increasing the health costs of the communities or of households, or again also reducing the time that people are able to spend on active economic activities, which is replaced with just using that time to look for water. Then we can be able to reduce poverty. We can be able to promote equality by ensuring that women really don't have to be so much concerned about how to just get water for drinking, for cooking, and for washing, but just basically allow them to be able to participate in better socioeconomic activities. And that is one of the things that really becomes very, very important in water, sanitation, and hygiene management. Then drinking water and sanitation have actually been targets of the Millennium Development Goals for before. You remember the Millennium Development Goals were actually active before the year 2015. That's when we really spoke about the Millennium Development Goals, and it had water and sanitation goals before we transitioned to the Sustainable Development Goals in the post-2015 period. And so far, we also have SDGs that are dealing with the whole issue of water, sanitation, and hygiene management. And member states of the United Nations were very, very critical in terms of ensuring that universal access to water, sanitation, and hygiene is actually achieved by the year 2030. Now, the human right to safe drinking water and sanitation, that is WHRTWS, was actually adopted in 2010 under a UN resolution that was basically advocating for safe, affordable, acceptable, available, and accessible drinking water and sanitation services for all. And I want you to note for all. That's one of the, it's a very robust target that basically tries to make sure that everybody, regardless of where they are in the world, here we're talking about people who are probably living in informal settlements, in urban centers. We're talking about people who are living in rural population, in maybe semi-arid and arid environments. We're talking about the people who are living in cities. We're talking about people who are living in some agricultural developments of farmlands. And we say that it is important that they all have safe, affordable, acceptable, available, and accessible drinking water and sanitation for all. So it's very, very important to make sure that we are able to look at that. Again, the other thing is that the Sustainable Development Goals have basically been able to spark a renewed focus on what strategies will actually be necessary to make sure that we are able to achieve universal access to safe water and basic sanitation by 2030. And it is important that we are able to look at the issue of the achievement of the Sustainable Development Goals by the year 2030 as much as we can. Now, there are critical challenges that are basically becoming some critical challenges in ensuring that we can achieve sustained universal access to safe water and sanitation in developing countries. There are a number of challenges. So one is, of course, the scale of the need for safe water, sanitation, and hygiene. That's why earlier on I asked you to note, when you talk about that the UN was able to make that target for all, you realize that the kind of need that is there in the world. And in a short while, I'll be talking about the scarcity of water globally. You will be able to see why that really becomes important, and to look at the scale of the need that is actually there in terms of provisioning safe water, sanitation, and hygiene as well. And secondly, also the other issue is the variability of water and sanitation problems, and also consequently looking at the variability of solutions from place to place and from time to time, because you realize that water and sanitation problems will always be variable because of probably weather patterns. Certain times you realize there's less rainfall in certain places, there's more rainfall in certain places, and so the issue really is very variable. And particularly now when we are living in the age of the global climate change, it basically affects that as much as possible. And then again, also how to best sustain essential wash services over the long term. And I think it is good to make sure that we are able to sustain essential wash services over the long term. So it's very, very important to make sure that we are able to look at that. Now, again, also, it is also important to think about how to reach people with who are most in need. It is also important to make sure that we are able to target some of the people who are most in need, because some people are living in areas where there is higher need than some places. And then also the whole importance of ensuring that there is integration of water, sanitation, and hygiene for health. So it's very, very important also to make sure that some of those things are well looked into. Now, if you look at some of the common types of wash intervention that we normally do, and I will be looking at the issue of water supply, the issue of sanitation, and the issue of hygiene promotion. I think this table basically, I want to use it just to be able to summarize for you what are the interventions that we can actually be able to have in WASH. So when you're looking at water supply, one of the things is to look at the issue of rehabilitation of existing systems, looking at the whole issue of the boreholes that sometimes we don't have in certain areas, to make sure that we increase water supply in some of these areas. There's also the issue of the private or communal improved supply and distribution by using things like hand pumps or household connections. Then there's also the issue of water source protection and treatment, which is also something that really becomes very, very important. And then again, also point of use water treatment, where we are able to look at how to do solar disinfection, how to be able to do chlorination, how to be able to do boiling, how to be able to do safe storage and simple filtration where necessary. And again, also rainwater harvesting as expected. So those are some of the things that really become quite critical to make sure that we need to be able to undertake some of those things. So I think it is important for us to be able to note some of those interventions. And then again, also when you look at sanitation or excreta, you're looking at what are some of the community latrines that can be done, defecation fields, borehole latrines, trenches, private latrines or pocket latrines, and some interventions that relate to hygiene promotion will be like the FAST approach or the CHAST approach, the CLTS, which we'll be mentioning about, and also the issue of social sanitation marketing, which is also something that is important to make sure that we are able to achieve as much as possible. So those are some of the things that we are able to look at. Now, if you look at the effectiveness, also, I think it is also good to make sure that we are able also to look at the effectiveness of water wash interventions in terms of the evidence base. You realize that inadequate sanitation and also inadequate water supplies and poor hygiene are critical determinants for survival, particularly in emergency context. And when we are talking about emergency context, we are talking about some of these places where we know they've been hit by disasters, or rather we have refugee populations that are migrating and camping in some of these areas, critical emergency contexts. And in some of those areas, then you realize that the issue of inadequate sanitation, inadequate water supplies, and poor hygiene would really matter in terms of whether the people living in this emergency context are actually able to survive. That really becomes a very, very critical thing. And most significant challenges in this context are basically diarrheal diseases and also infectious diseases that are normally transmitted by the fecal oral route. Remember, one of the reasons why we really try to make sure that we address the issue of sanitation and also the issue of water supply is because of this main pathway or main transmission mechanism of the fecal oral route that basically brings rise to diarrheal diseases and infectious diseases that are basically transmitted through the fecal oral route as expected. And there's a combination of a number of factors that basically means that people living in the emergencies are also generally more susceptible to illnesses and death from diseases. And it is important to make sure that we are able to use a combination of these factors to make sure that people living in emergencies are generally much more susceptible to illnesses and also to death from the diseases. And exploring, while trying to explore the evidence base, then if you look at a review of the evidence base for WASH interventions in emergency responses that was done by Parkinson in 2009 is very critical because the aim of this research was actually to be able to review and also assess the existing evidence that allows WASH interventions in the emergency context, and particularly those ones that are related to water supply, sanitation, and hygiene. So it's very important to make sure that some of these factors that make people living in emergencies to be so much disadvantaged and to make them more susceptible to illnesses and death from diseases are basically addressed so that we can be able to place the issue of WASH management as a very pivotal need, particularly for these communities living in emergency context as much as we can. So it's very important to make sure that we are able to do that. And so the following was basically identified in this study as some of the programming or implementation issues that will actually be able to influence the effectiveness of WASH interventions. These are some of the things that were quite critical from this study by Parkinson. And one of the things that was also coming out clearly was the issue of ensuring that we are able to establish WASH priorities and also planning objectives for WASH very well. And again, also ensuring that we do community mobilization and sanitation promotion becomes very important. And in community mobilization, we have one of the approaches that we'll be looking at, that is the CLTS, community-led total sanitation, become very important in terms of addressing the community to mobilize themselves towards addressing sanitation challenges. Then again, also the issue of planning and timing of WASH interventions is very critical, because you realize there are certain times when WASH interventions are critical, particularly in times of flooding or when there is increased rainfall patterns. It is always good to make sure that we are able to plan and also time the WASH interventions. And then the other thing is also to make sure that we are able to encourage the sustainable use of WASH facilities, which becomes quite critical to make sure that we are able to use WASH facilities as expected. Then again, also it's also important to make sure that we are able to integrate both hardware and software interventions for WASH, and ensuring that we're able to have a balance on that, because a lot of the times you look at a lot of WASH interventions and they focus more on construction of WASH facilities, But then again, also it's significant that we also invest in approaches that can allow people to change their behavior patterns. And that is why now the software WASH interventions really become quite critical. So it's important that we are able to look at that. Now that sets the context of why, therefore, it is important to be able to study more about WASH and ensure that we can actually be able to understand how to be able to manage WASH effectively. And the following were some of the things that were identified as the programming or implementation issues that would actually be able to influence the effectiveness of WASH interventions. And one of it was ensuring that we are able to establish WASH priorities and planning objectives. Then secondly, also ensuring that community mobilization and sanitation promotion really became quite critical. Then again, also ensuring that planning and timing of WASH interventions also became quite critical. And then again, also trying to encourage the sustainable use of WASH facilities is also quite critical. And then ensuring that we are able to integrate both hardware and software WASH intervention. So some of these things really are quite critical to set the base why WASH is really important, and it should be something that should generate a lot of interest for you to study this area, because a lot of organizations are basically working in the WASH sector, and it is important that we are able to address some of these challenges of the now and also of the future. Now let's look at the global distribution of fresh water. And one of the things that you will also be able to see in this is that human beings normally depend on access to enough fresh water for their survival. In fact, you will be able to realize that 97% of water globally is salty. And this is something that you can actually be able to see, because 97% of water is in the earth is in the oceans. So the oceans make up 97% of water. This water is seawater. And for most of you who have tried to taste ocean water, you know, when you talk about salt, is that it is so salty. It is not drinkable at all. And one of the things that this water therefore presents is that it cannot be used for most human uses and consumption. And that is why now the water that can actually be consumed in the entire world is, you realize that it is actually less than 1%, because even the 2.5% fresh water that can be consumed in the land surface is actually frozen. So 2.5% of water is actually frozen. So it's not even available for immediate consumption. Now, you only find that now the less than 1%, that is the remaining one, is available in lakes, is available in rivers, it is also available in shallow groundwater basins, and it's easily accessible. So you can imagine the entire world has to be able to depend on this water for consumption. And now that is the challenge that we actually need to be able to see. So it's also a challenge that is presented with the issue of availability of water. But then again, also in terms of scarcity of water, you can be able to understand that most of these water resources that we are saying that less than 1% that is available for consumption are also going through a lot of increasing pressure because of things like population growth, things like urbanization, a steep increase in water consumption for domestic uses, for agriculture, for livestock, for industry, have significantly been able to heighten water consumption. So we have less than 1%, but then again, there is increasing pressure on some of these water sources. And again, now, the other thing that actually complicates this problem is the issue of climate change. Now, you remember recently we have had COP26, and the issue of climate change continues to challenge the world leaders to be able to consider, do we actually ease pressure on economic activity so that we can save the challenges that we are having on climate change. And there's a lot of struggle around climate change, but we know climate change is one of the issues that is basically exacerbating the issue of global water scarcity. And this problem has actually been able to lead to water scarcity and even future conflicts, as water resources that are shared among different nations and regions and ethnic groups are basically becoming a source of conflict. All of us are aware about the current disquiet between Egypt and Ethiopia because of the Grand Renaissance Dam that is being constructed by Ethiopia, and how that is going to be able to have potential challenges for Egypt that solely relies on River Nile for its agricultural irrigation. And you can actually be able to see some of the challenges that are presenting themselves in the future. And that is why at the occasion of the World Water Day in the year 2013, the UN was able to present a fact sheet which was able to highlight water scarcity as one of the main problems that will be faced by societies in the 21st century, as you can see highlighted in this particular map. Now, this map clearly points to you areas where water scarcity is extremely high and where it is extremely low. And you can actually be able to see some of the areas that we have deep brown in that particular picture. You are able to see that those are the areas that have potential for water scarcity. Maybe these are regions that basically lie in these are areas that actually fall within the arid and semi-arid regions of the world. And there's extreme water scarcity there that really presents a challenge for some of those countries in terms of access to water. And this is something that therefore really increases the concern for most development organizations on how they can actually be able to improve this access of water. Becomes a critical thing on how we can actually be able to improve it. So I think it's good for us to be able to see that. And I think there's no better way than just to present to you the challenge of global water scarcity better than just to present to you the photograph that you can see in your screens there, where you're able to see that water is such a precious commodity in some of these areas. You can see a man there, a pastoralist, probably consuming water from a shallow dug well. And of course, even a look at that well, you can already see that that water is already contaminated. And probably this is water that is meant for consumption for some of these communities. And this basically paints you a problem about the challenge that is there in terms of scarcity of water for some of these areas that we need to be able to understand. Okay, so we've discussed much about the issue of scarcity and availability of water in globally. But then again, let's also look at the sphere WASH standards that are there, and are just trying to look at some of the standards that can help us ensure that we're able to provide the bare minimum for some of these populations that are basically living in these areas where there is water scarcity. So what the sphere standards does is that it has come with some standards and some targets for the different components of water supply, sanitation, and hygiene promotion, which we normally shorten as WASH. And it has been able to put down some standards in regards to hygiene promotion. Secondly, also put some standards in regards to water supply. Again, also put some standards in regard to excreta management, and then also some standards in regards to vector control, and again, also some standards on solid waste management. And then again, also some standards on WASH in disease outbreaks and healthcare settings, because also you realize in healthcare settings, there are very specific standards that need to be there to make sure that some of these areas are able to make sure that there's some proper standards that need to be in place. So, so it's good to make sure that we are able to understand that and ensure that we can actually be able to work with some of these areas and ensure that we can be able to look at some of those things as critically as possible. So the other thing that is important to note is that in terms of hygiene promotion, you realize that we have some standards on hygiene promotion in terms of identification, access, and use of hygiene items. Then we also have a specific standard on menstrual hygiene management and incontinence. And this is becoming an important area because we know that our young girls, particularly in schools, are not able to access menstrual management products and services, and it becomes an area that we need to be able to put standards to make sure that we are able to ensure that governments and also development organizations are able to address some of those challenges to make sure that they fulfill the standards. And there's also the issue of water supply, where we are looking at access and water quantity. That really becomes a critical issue to be able to look at. Then there's also the issue of water quality and standards there. And also on excreta, we have an environment free from human excreta becomes important. Then access to toilets and the use of toilets. Then management and maintenance of excreta collection, transport, disposal, and treatment. And then, of course, we have some extra areas to look at in terms of vector control, solid waste management, and WASH disease outbreaks and healthcare settings. So, so these are very, very specific. This is just a summary, some summary way to show the standards that are available in the sphere WASH guidelines. But if you go to the handbook, you will actually be able to see the details and the specific targets that are set in this, and also the indicators for tracking. But let me just mention something about hygiene promotion standards. I think it is important to make sure that people are basically aware of key public health risks that are critical to be able to look at, and also the issues that are related to WASH, and also adapting the individual, household, and community measures to be able to reduce them. And here we have things like the standard for hygiene promotion, the standard for identification, access, and use of hygiene items, and also the standard for menstrual hygiene management and incontinence as expected. Then there's also the issue of the water supply standards, and water supply standards basically should be able to look at the issue of water access, what what is the standard for water access for some of these communities, and also the water quantity, and also we cannot be able to ignore the issue of water quality as well. Really becomes quite critical. And you know, as I said earlier on, as you can see, women spend a lot of time and a lot of hours in different areas, just trying to look for this valuable commodity known as water. And they sometimes are forced to walk kilometers to be able to find such a borehole as this, as you can see in the photo. So it's important that we have a standard for equitable and affordable access to sufficient water that is safe to be able to meet drinking and domestic needs of households. That really becomes something that is quite critical to ensure that we are able to emphasize as well. Now, the other thing that is also good to be able to mention is also something that we need to make sure that we are able to emphasize, which is the F diagram. And the F diagram really becomes important. And it is important to make sure that we can look at the significance of this F diagram. Why is there talk about the F diagram a lot in WASH interventions? Is because when you're able to understand the F diagram, then you can be able to put your WASH interventions in areas that basically cause become the most transmission pathways of diseases. And I think the first thing that I would want to be able to do is to make sure that I'm able to emphasize that one of the things that is normally very critical in terms of WASH programming is to make sure that we are able to reduce public health risks by ensuring that we are able to create barriers along transmission pathways, and that really becomes quite critical. And the main objective of WASH programming is to ensure that we can always be able to reduce the public health risks that will be there by ensuring that we are able to create barriers along transmission pathways. Now, question is, are you able to identify some of the main pathways through which pathogens infect the human body? Somebody who can mention that? You can raise your hand. We will be able to see that. What are some of the common pathways? Some of the common pathways? Yes, wisdom. Wisdom. You can mention.
Yeah, by the hand. We touch them and then we eat with our hands.
Hello, wisdom.
Yeah, hello.
Yes.
Yeah, I said we by hand. We touch.
Yeah, by hand. Yeah,
yes,
that's
and then
one
we
of
eat with them.
Yeah. If your hands come into contact with fecal contamination, then of course is one of the critical pathways of transmission, and there are many more. I don't know whether somebody else wants to mention something else. You want to mention something? Amadou Barrow? Amadou Barrow?
Hello.
Yes. Is that Amadou? Okay, so I'm not able to get Amadou Barrow. Antonio Machava. Okay, so I think we have probably some challenges on unmuting our audio, but Othiambo, Goa.
I think through we can be infected by pathogens through the nose by inhalation.
Yeah, through the nose by inhalation, that is also, and you remember that has really become significant, especially in the recent times with the wake of COVID. That has really become one of the most significant transmission pathways that is actually even forcing populations in different parts of the globe to wear a mask always. And that has been practiced in a lot of countries today because of that particular challenge. And it is important to make sure that we are able to manage that as well. So Elias is also saying when we wash our hands with contaminated water, yeah, those are some of the transmission pathways that we can always be able to have. Now, so therefore, the main pathways for pathogens to infect human beings are basically listed as feces, fluids, fingers, flies, and food. And this normally is the basis of the F diagram, as we can see. So it's normally known as the F diagram that basically shows us these transmission pathways that largely happen through contact with fecal matter, contact with contaminated water, that is fluids, fingers, flies, and food. And this gives us the basis of the F diagram. That's why we say that in order to make sure that we are able to protect ourselves, or rather, we also try to protect the communities in which we run certain WASH programs on behalf. I think it is very important that we are able to understand the F diagram so that we can be able to put some primary measures and secondary measures to make sure that we have barriers that prevent the transmission of the diseases. And some of these primary measures will be by preventing the initial contact with feces, and also some of the secondary barriers that prevent it from being ingested by another person. And this can actually be controlled by WASH interventions critically. So it's very important to be able to look at some of those barriers as expected. Now, so this is a common discussion in WASH interventions that we need to be able to come up with an F diagram for our WASH interventions to make sure that we can always avoid some of the critical barriers that are main transmission pathways. Now, the other thing is to be able to look at this approach that we emphasize was very critical. That is having an overview of the community-led total sanitation, that is the CLTS, that we actually need to be able to look at. And you realize that this is an approach that basically triggers the community into action by ensuring that we are able to conjure disgust and shame among the members who actually practice open defecation. So this is one of the things that we always want to be able to put in place so that we can make sure that people feel disgusted and feel shameful by practicing open defecation. And normally, when you're able to trigger this in the community, then there needs not to be an external force, because if this comes from the community, it actually becomes very, very effective. And the ultimate objective of this approach is to make sure that we are able to achieve total sanitation that is actually marked by 0 cases of open defecation, so that we can be able to arrive at a point known as open defecation-free status. So it's always good to make sure that we can come to the point of ODF status, which is something that a lot of CLTS approaches always want to be able to come into. And it primarily focuses on change at the community level and not at the individual household level. So it is something that really needs to come up as a community level intervention, and not just an individual intervention as well. So it also uses a non-subsidy approach in which the target community is actually triggered and left to decide the actions that they will need to be able to take to address their sanitation problems. And you know, a lot of approaches that we use are subsidy-based, where you have to come and put some subsidies in place in the community. But you can see this one, we invest more on triggering the community so that they do not expect subsidies, but they will actually be able to take actions that will help them address issues of sanitation problems, creation of toilets and latrines, so that they can actually be able to ensure that they are able to stop the issue of open defecation as much as possible. So what are some of the possible advantages that are there with CLTS or community-led total sanitation? So one is that this approach is community-led, so it does not rely on sanitation subsidies from external agencies, and that is one of the advantages that we are able to find. And then again, it also promotes sanitation and hygiene strategies that the community can actually be able to afford. And again, also it encourages the community on hygiene behavior change without prescribing how to be able to do it. And that really becomes quite important. And then again, also the community can be able to spread effective behaviors to other communities, hence widening the scope of the change as expected. So that's something that we are able to find when it comes to CLTS. But then again, all approaches will always have advantages and disadvantages, and this also has its own disadvantages in the sense that the success of this approach is mainly dependent on the people who are facilitating this particular approach, and also doing the training and also the motivation, because if the community does not have the motivation to be able to change these practices, then it will be very hard to be able to succeed. And that's something that is actually reliant on this. And then the sustainability of the CLTS is not reliable due to the cheap approaches that are normally used in some of these approaches. So it's very important to be able to note that. And that's one of the things that we need to be able to see. So it's a very popular approach. It would be good to try to implement it for some of us who are working in WASH to make sure that we can readily be able to use it, particularly in communities that are still practicing open defecation. And that brings us to the end on the discussion that we needed to be able to have for this period of time, which could be morning to some of us, could be mid-morning, could be evening, could be night for some of us, depending on where you're connecting from. But basically, let's be able to have some feedback session, which we need to be able to hear your comments and questions in regards to some of the things that we have actually been able to cover today. So, so it's important to be able to look at that. So let me just open the platform now for us to be able to hear your comments. I think it would be good if you can be able to raise your hand so that you are unmuted, because I don't think you can be able to unmute on your end. So it would be good if you can actually be able to raise your hand so that we can ask you to put your question or comment, say how the session was important for you. It would be good to be able to get that feedback. Yeah, so let's start with Eunice. I can see Eunice, your hand is up. So let's start with Eunice. Just hear your comments regarding what we have been able to look at.
Thank you, Steve, for the good presentation. My question is on the interventions for the WASH. And do you think that finances should be one of the interventions to fund the WASH projects? Because we might be having these good ideas, but if we don't have enough finances to fund that, it might not be achievable. As we are aware that the Sustainable Development Goals, one of the major challenges we are facing on implementing them is the area of financing those goals. Thank you.
Yes, I think the issue of finances availability or donor aid is critical. And I think one of the things that is actually challenging us, even in terms of implementation of some of these WASH interventions, and also even the sustainability of some of those interventions, is basically centered around financial resources. And that is why we are continuously also asking for organizations to make sure, or communities or individuals to make sure that they are innovative in the way they look around the issue of finance, because remember, the extent or the scale of need is high, and sometimes we don't even have enough finances to address all the needs that we have. So, so it's like we have to be able to go for community solutions and for individual solutions to make sure that we are able to address the issue of the financial gap. But of course, that's why there's also quite some talk on the issue of running organizations and social enterprises where we can generate funds from one end and also use the same funds to be able to do some humanitarian or development interventions on the other hand. And it remains a challenge, but as much as possible, that is why we also are encouraged to make sure that we can also develop the capacity to write a lot of proposals and very interesting proposals that can actually be funded, so that we make sure that we do not lack finances to implement some of those interventions. So it's true. I agree with you, Eunice, and it's a critical effort that we have to make in that particular area. But being innovative, turning our attention to social enterprises can help a lot, and also allowing individuals and communities to be able to lead the interventions really becomes important. So thank you, Eunice, for that. Can we also be able to hear from Shadrach Gwari? Shadrach Gwari, your hand is up as well.
Yes. Mm-hmm. Mine is a comment to say thank you very much for the presentation on water and sanitation. But now again, on my comment, I'm trying to say, can we have water and sanitation linked with other interventions? Because I've seen a tendency of specialization whereby you see someone is a water and sanitation specialist, this one is an agricultural or agronomy specialist, this one is a livestock specialist or humanitarian. My experience in the NGO sector is that while you are carrying out your livelihood activities, or while you are carrying your small livestock activities, you also realize the need for WASH interventions. So it would be nice for these interventions to be linked or to be approached in a wholesome approach, where a holistic approach kind of is implemented. Because you find some organizations, like I also asked when I was monitoring evaluation, they only say higher.
You're breaking, Shadrach. You're breaking. If we can repeat the last statement you made, I think you.
Okay.
Yeah, you.
On the last part, I was saying, on the issue of hiring personnel for WASH, you will find that a specific organization will say we only want someone who specialized in WASH, but there could be also other interventions that needs attention. So my recommendation would be to organizations or you as trainers to come up with a program whereby different interventions also cover up water and sanitation is a component. So we do a holistic approach. Say, well, as I'm doing my livelihood project, I should also be, because all these things at the end of the day, they affect the lifestyle of the person we are trying to assist. Thank you.
True. And I think it's quite important what you're saying, because there are a lot of specialties in the development and humanitarian sectors. And sometimes you find that sometimes being able to get personnel that can specifically work in the different specialization sometimes becomes very, very difficult, or sometimes you realize that also the spread of donor aid is spread into the different interventions, and you realize sometimes we do not even have enough capacity to thoroughly implement our programs. And sometimes it's a challenge that we have to deal with, but I think sometimes it's also the issue of it might not be possible to get everybody specialized in the different interventions, and that's why when somebody is able to pick an area, then you're able to specialize in that particular area. If you pick something on to basically work in the water, in sanitation and hygiene specialization, then you have to be able to push towards that direction. But this is an area that will continue getting a lot of attention, more so in the future, where we are expecting to have a lot of dealing with climate change issues and a lot of climate crisis. And this will really become an area that will draw a lot of attention to the development and humanitarian organizations, and also to governments as they deal with the crises of the future. And I think it's something that we have to balance and try to find a better way of ensuring that we still work with the specialists that we have, and how can we be able to improve their skill level so that they can be thorough in the implementation of the specific approaches. So I think that's what I can say for now, Shadrach, and I hope that serves you well, and maybe I can be able to cross over to the next comment or question from Wisdom. Wisdom, you are there?
Yeah, hello.
Yes. Please proceed, Wisdom.
Okay, can you hear me?
Yes, I can hear you now.
Okay, you made a general overview of the CLTAs. I'm looking at the urban side. You realize that in urban Africa, let's say Accra, for instance, there are more communities without toilets because they don't have land spaces. Now, such communities, how do you collaborate with them or even partner with government institutions? Because if there is no enforcement, there's not going to be the disposition to build toilets or engage in proper hygiene. How do you do or deal with such instances in the urban areas? Thank you.
So yeah, that's a good question because we continue facing the issue of rural-urban migration, and as most of you know, is not only in Accra, but of course in most cities, particularly in Africa. You realize that people move to the cities for better economic opportunities. And this is also complicating the issue of urban settlement, where you realize now there's also an influx of slums coming up in urban centers. And one of the biggest challenges, in fact, in some of these informal settlements in the urban areas is even now, if you look at sanitation, where do you even get land to be able to build toilets? And one of the things that really should be an emphasis, particularly in some of these informal settlements, which I think like in some of the settlements, like one of the biggest slums in Africa that is known as Kibera, where you realize that people even use flying toilets, where it basically means people just have their fecal matter thrown off to where it will actually be able to land, whether it can land to someone's door, door front, it doesn't matter, but normally that's how they deal with fecal matter because of the issue of land space. But I think continuous engagement of these communities and also involving the government is very helpful for people. And I think also the CLTS approach really becomes important for some of these communities, so that they can actually be able to see why they need to be able to stop the open defecation challenge, and basically be able to prioritize spaces for latrine construction, and maybe work with development partners or government to get some available funding, so that some of these communities can have access to toilets. Because now in urban areas, sometimes also latrine is a challenge to be able to come up with, but the public toilets that are probably managed by municipal centers really become a helpful intervention for some of these areas. So, so this is one of ways to be able to address that, and hopefully still the CLTS approach really becomes important, so that it comes from the community themselves, comes from the slum communities, comes from the informal settlement communities, that it is important for them to deal with the sanitation challenge in their area. So, so that's what I can say for now, Wisdom, and I hope that rests your question quite well.
Yeah, I'm very grateful. Thank you.
Okay. Yeah, so so I think it's good to be able to hear that, and I think I don't know whether it's important to be able to take any other question, but I think also in the interest of time, I think I might want to be able to hand back the session back to Rachel, and maybe tell us how to proceed from here. But I think on my end, that is what I wanted to be able to discuss for this particular moment. And feel free, continue sending your questions even through the email provided. We are always able to answer them, and also make sure that you can also sign up for our courses for more interactions on this subject. So Rachel, I just want to hand over back to you. I don't seem to see any other hand lifted, and I just want to hand over this over to you.
Thank you, Stephen. Thank you so much for that great and wonderful interactive presentation. And thank you to all our participants for attending and engaging in this interactive session. I'd like to hand over now to my co-moderator, Beatrice, to do the vote of thanks. Thank you so much. Beatrice?
Hello, everyone. Thank you very much, Stephen Mushami, for that wonderful and informative session. I want to thank everyone for taking your time out of your busy schedule to participate in this session. I also would like to appreciate the team that worked tirelessly hard to ensure that this webinar becomes a success, starting from John, Sandra, Victorine, Rachel, Mushemi. Thank you so much for the presentations that were done extremely well. I would like to say thank you to the IT department led by Nick and Eliza behind the scenes. I appreciate everyone for taking time. I would wish to request that you fill in the form that was shared by Victorine, especially those that are interested in taking a course with us, a course or two with us. Kindly fill the form. In case you have any questions, concerns, kindly send an email to the email addresses that were provided in the chat session or WhatsApp number that was provided by Victorine. Also, subscribe to our YouTube channel and check out the channel for more of these webinars and even workshops. Do have a great morning, afternoon, and evening, everyone. Thank you once more. I can now say goodbye to everyone. You can leave at your own pleasure.
Did you know that 67% of Africans don't have access to proper housing, 56% have no access to water, and 79% have no access to food? These are the grim statistics of challenges facing Africa today, even as the continent works to develop. This development demands for well-trained personnel. At Capacity Africa Training Institute, we have been leading the charge in changing Africa's fortunes. We are the leading development training company in Africa, offering institutional training solutions and online and distance learning in business, development, and humanitarian courses. Over the last 10 years, we have trained over 10,000 staff from NGOs, governments, and the United Nations in Africa. Our catalog consists of over 200 career-focused online courses to choose from, and registration for diploma and postgraduate courses is now open for the following courses: Postgraduate Diploma in Monitoring and Evaluation, Postgraduate Diploma in Water, Sanitation and Hygiene, Diploma in Community Development, Postgraduate Diploma in Strategic Planning and Management, Postgraduate Diploma in Grants Management, Diploma in Project Management, Diploma in Nutrition and Dietetics, Diploma in Gender and Development, Diploma in Leadership and Management, Diploma in Finance Management for NGOs, and many more. We have also partnered with the European International University to offer an executive MBA. Once you register, you will have access to our team of experienced trainers and specialist consultants who will guide you on your course whenever you need them. The cost for diploma courses is $800 while postgraduate courses cost $1,200. The cost of a one-year MBA course is €1,500. Visit www.capacityafrica.com for more information.
It's no secret that Africa is the next frontier,
and you can be the next big investor. At Strategia Business School, we'll offer you a monthly masterclass that will help you build your network among respected entrepreneurs and business leaders and guide you on the opportunities available and how to mitigate any challenges of investing in Africa. Our African Business Club will also introduce you to our team of African business mentors and fellow investors, all tailored to your very own needs. Among the modules covered are doing business in Africa, raising investment and trade finance, importing from Africa and exporting to Africa, agribusiness opportunities in Africa, and understanding the African market. You can also register for online diploma business courses with a flexible learning schedule. Some of our courses include Diploma in Digital Marketing, Diploma in Sales and Marketing, Diploma in Finance Management, and Diploma in Logistics Management. Certificate courses run for 3 months, while diploma courses run for 6 months, and you can register at the beginning of every month. The cost for certificate courses is 500 euros, while diploma courses cost 800 euros. Take action and register today. For more information, contact info@strategiabusiness.com or visit www.strategiabusiness.com. Are you interested in building a career in the development and humanitarian sector? Then, Strategia Netherlands is the best option for you. We offer training solutions to the United Nations, governments, NGOs, and other development organizations worldwide. Make your online application now for Diploma in Monitoring and Evaluation, Diploma in Grants Management, Diploma in Conflict Management, Diploma in Disaster Management, Diploma in Water, Sanitation and Hygiene, and many more. The cost for diploma courses is 800 euros, while postgraduate courses cost 1,200 euros. Visit www.strategianetherlands.nl for more information.